So now we're going to focus on cells that are giving you the immune system, right? The immune system is a cast of characters, and everyone has their own role. Instead of memorizing them separately, let's build a story, right? So now our video is going to be the immune system city. So now a bacterium enters your body, and who responds first? The first person to respond is your neutrophil. The neutrophil is your emergency police. These are the first responders. Okay, so we talk about the neutrophils first. The neutrophils are the emergency police. They're the first responders. Their main job is to kill bacteria. Now, how do they do this? They basically kill the bacteria by phagocytosis, releasing enzymes and producing reactive oxygen species. Their appearance is basically the 3 to 4 lobe nucleuses, right? And they're these pale granules. Whenever you think about bacterial infection, you think about the neutrophils increasing. Now they have specific granules. They contain lactoferrin, lysozyme, and collagenase, right? All of them help to attack and kill the bacterial cells. And you have eosinophilic granules, which contain myeloperoxidase, acid phosphatase, and lysosomal enzymes. All right, so think of the neutrophil as this tiny soldier that carries 2 weapon bags. Some are specific granules, and these specific granules are basically secondary granules. So these 3 granules capture and weaken the enemy. The lactoferrin, the lysozyme, and collagenase capture and weaken the enemy. The acidophilic granules, they basically are the primary granules. So they finish the enemy off. They contain myeloperoxidase, they contain acid phosphatase, and they contain lysosomal enzymes. Now, first step is that the neutrophils find the bacteria. They migrate to the site using chemotaxis and engulf the bacterium by phagocytosis. They trap the bacterium inside a vesicle, which we call a phagosome. Now, the bacterium is inside the neutrophil but not dead yet, right? So, specific granules attack first. So, first, you get this lactoferrin. What does the lactoferrin do? The lactoferrin basically, this lactoferrin, what it does, the bacteria needs iron to grow. Lactoferrin grabs the iron and hides it from bacteria, right? So no iron, bacteria cannot multiply efficiently. Next is lysozyme. What lysozyme does is it basically cuts the bacterial cell walls, especially this is especially effective against gram-positive bacteria. It breaks the peptidoglycan cell wall and then it weakens that cell wall and the bacteria bursts. So think about the brick wall, right? So the lysozyme removes the cement between those brick walls, right? And it also has a collagenase. What the collagenase does, it breaks down collagen in connective tissue. Now, why would a neutrophil want to do that? To help itself move through tissues towards infection. It acts like a bulldozer, clearing a path, right? So the collagenase basically kills all the things inside its path. And in order to be a bulldozer and clear its path, it needs to break down the collagen in connective tissue. Too much collagenase contributes to tissue destruction and severe inflammation. So too much collagenase is also a bad thing for us because that will lead to tissue destruction and severe inflammation. Now we have the respiratory burst. In the respiratory burst, we are going to use these granules, right? Now the respiratory burst begins. The neutrophils now activate, and this basically activates the NADPH oxidase, right? This is very important. Let me write that down here. Now the respiratory burst is very important. So for the azophilic granules, we need to work with the respiratory burst. The neutrophils now activate NADPH oxidase. This creates a superoxide. The oxygen is converted into superoxide, and this oxygen is then converted into hydrogen peroxide, right? Now, this hydrogen peroxide, what it does is these oxygen radicals are already toxic. The superoxide is already toxic, but neutrophils make them even deadlier, right? Now, the azucarera granules release their weapons. They're heavy artillery. They're very deadly, right? So the first thing is myeloperoxidase. This is the most important enzyme. The myeloperoxidase uses this hydrogen peroxide, right? And it adds it to chloride ions and creates hydrochloric acid. So it's basically bleach, right? So you get this hypochloric acid, we call it hypochlorous acid, and it's basically bleach inside the neutrophils. Just imagine. So the reaction is basically H2O2 plus the chloride, which gives you HOCl. Now, this hypochlorous acid, which is somehow like literally bleach, destroys the bacteria, fungi, and viruses very rapidly. So if a child has recurrent Candida infections, our neutrophils can still make reactive oxygen species, but they can't bleach, then the diagnosis is a myeloperoxidase deficiency. Because the myeloperoxidase basically goes ahead and makes the bleach that kills the bacteria, virus, and fungi. Then we have the acid phosphatase. This functions best in acidic environments. It helps digest bacterial components after killing. So you think of the acid phosphatase as a cleanup crew, right? Sorry, I lost you there for a second. Then you have lysosomal enzymes, right? Lysosomal enzymes basically, the lysosomal enzymes include proteases, elastase, and hydrolases, right? Now, these proteases, I told you that the acid phosphatase basically works best in acidic environments. It helps digest bacterial components after killing. And think about this acid phosphatase as the cleanup crew. And then you have lysosomal enzymes. These include these proteases, elastase, and hydrolases. They digest proteins, membranes, and bacterial debris. So basically, these lysosomal enzymes, using the proteases, elastase, hydrolases, they digest the proteins, membranes, and bacterial debris. So after the MPO kills the bug, the lysosomal enzymes chew up the remains, right? They digest the proteins, membrane, and bacterial debris. So when you put it all together, the bacterium enters and the lactobin steams the iron. The lysosomal enzyme breaks the cell wall, especially gram-positive peptidoglycan walls. And the collagenase helps the neutrophil move through the tissue, and this leads to a respiratory burst, which then allows the superoxide to be used to make the hypochlorous acid, which is basically bleach, and then the acid phosphatase and lysosomal enzymes digest the dead bacteria. That's like so cool. Like your neutrophils are so cool, man. And then we have hypersegmented neutrophils. Why do we get hypersegmented neutrophils? Sometimes now normal neutrophil has a 3 to 5 lobes, but abnormal ones have more than 6 lobes. Why does this happen? This is seen in vitamin B12 and folate deficiency. What is a left shift? A left shift is when the bone marrow releases immature neutrophils called the band cells. The precursors of the neutrophils assist in acute bacterial infection and severe inflammation. Now, there's something known as the chemotaxis mnemonic, right? So, what happens is that whenever neutrophils basically follow certain things, they follow C5a, they follow interleukin 8 and LTB4. So you think about coming in late, you think about C5a, interleukin 8, and LTB4. Now you have a classical unit where a patient has fever, productive cough, and neutrophils, right? So 18,000 neutrophils, most likely acute bacterial pneumonia, right?